Hello, my name is Manoj Saxena. I am Managing Director for Bayer Zydus Pharma as well as South Asia Head for Bayer Pharma. I am based out of Mumbai. Digitization and cutting edge technology holds tremendous promise for patients as well as for the caregiver. Detection of early disease, better diagnosis, faster treatment, better management of the overall patient journey during the disease. I think I'll have great potential for the patient to have better management overall. And what it moves towards is, at the end, is around patient safety. And when we say that as a pharma company, Bayer is focused on patient safety, or we put patient at the center, we are talking about better outcome of any disease. Two examples to highlight it. Yeah. One is in the spectrum of how much amount of work we do to educate the patient so that he is empowered to have a better control of his own disease. Yeah. Because we know from various data points that patient education, helping him to understand the disease better, does play a significant role in overall patient safety. And the second is, today with digitization, we are also looking at artificial intelligence in the spectrum of how do the safety concerns are being reported. Yeah? And we call it as pharmacovigilance in the pharma industry. And we are working with our one of the partner there, where we are looking at building up artificial intelligence, machine learning, so that the reporting is easy, faster, and more predictable in that sense to help the patient to live a better life. So there has been enough of research done on that. Yeah, the research says almost 50% of patients are not able to adhere to the medicines. Yeah, the major reasons why of non-adherence is because of literacy around the disease, yeah, or medical literacy. The patients are not aware about their disease better. They are misinformed sometimes. They do not understand their prescriptions. Their forgetfulness, sometimes they feel that they are getting better so they can drop the disease. And all that significantly impacts the outcome. Yeah? So across the board, and more so in India, making patient better aware of the disease, making him aware of what he is going through, I think holds a great deal towards having a patient which manages disease better to have better safety as well and better outcome of the disease. Yeah. Adherence, as you know, is a topic around where the patient has to continue to trick. So more so in chronic ailments, and we know our society is aging, but we can also see from other countries. And particularly that non-adherence is seen more in the aging group. So prevention, whether it's diabetes, cardiology, where the patients have to take for longer terms. And that's what is the trend emerging out as well for aging population. Yeah, sometimes we feel that it's only patients who can have control on adherence, but I think doctors also play a very critical role in helping the patients to understand their disease, identifying clearly what are the do's and don'ts when they are prescribing a therapy, helping the patients to get to the tools where they can go back and read about the disease, so probably they are better aware of it, and timely interventions in terms of follow-ups and visits where the patient feels that he is in control, and also giving the space to the patient if for any reasons his disease deteriorating or he's getting any side effects, that he should report or he should go back to the clinician as early as possible. Actually, quite a bit. Bayer, when we say we put patient safety as an important or prioritized thing in our world, it's a commitment for good medicine. And that's what we do as a leader in the pharma world, but also as a leader in the pharmacovigilance area. We started Patient Safety Day in our organization a couple of years back, yeah, so that every stakeholders, not only people working in the pharmacovigilance, but every other stakeholders, every employee in Bayer understands patient safety is very important. Yeah. To an extent, more than 1,000 people work in pharmacovigilance area in Bayer. Yeah. And I think that's a great commitment to so that good medicine is understood, patient understand it. The second aspect is beyond our own employees, but going to the wider audience, which is patient, caregiver. How do we empower them so that they get the education around the disease and help them to have a better management or better control? Yeah. And the third piece is digital, where we are going in now. We are launching SafeTrack, which is an online web tool which simplifies the reporting, because as you know, in pharmacovigilance, reporting is critical, yeah, and we learn from each other, taking a medicine and improving the medicine or innovating for future medicines, learning on how the patients are taking the drug is critical. And that's where the digital tool, which will simplify pharmacovigilance reporting, would help. Yeah. As I said, Bayer, as a global leader, is also have leadership in the pharmacovigilance space. We have over 1,000 people working in the pharmacovigilance. We put reporting and safety as our priority. And I said, I'll repeat here, for Bayer, patient safety is not an obligation, but it's a commitment for good medicine. We celebrate Patient Safety Day. We educate patients, caregivers, doctors, all other stakeholders, so that they understand that pharmacovigilance or reporting of side effects is critical for the development of drug, making future drugs as well. At the same time, we also look at what can be done more and more, and I think Safe Track, which is a digital tool, is a step towards it. Yeah. That we will go into an online where for patients, for doctors, for healthcare giver, for regulators, it's an easier tool to report the drug. Yeah? I mean, more than 50,000 cases we report every year. And the third piece is around, which I mentioned in the beginning, is around how do we use increasingly cutting edge technology and artificial intelligence, where we are working with our partners Genpact to come up with solutions which could have a faster and machine learning techniques to have a better, faster, efficient pharmacovigilance program. I think as we know that the adherence is the biggest challenge. Yeah, apart from doctors, patients themselves can do a lot. Is first and foremost is understanding the disease, understanding what medications are they taking, being open about it with their clinicians, with their doctors or the healthcare provider. If they have any side effects or any concerns, any queries, do not hesitate to speak to their doctor. And if they have any side effect, please also, we always say that they should go out and report to the side effect, so that is being recorded, and that database gets to understand that this is the side effect of that drug. So if they understand the disease better, they are better educated around it, I think they have better control on their disease.